So today's topic is nutritional and food requirements of lactating mother. Those who have the textbook, it's chapter 9, page number 167. Chapter 9, page number 167. If anyone is joining late, please help them out with the page numbers. So starting this class, simulation of milk production. What stimulation leads to secretion of milk. Okay. So first it starts with the child who is sucking on the mother's nipple. Okay. When the child is sucking on the mother's nipple, that initiates some hormonal changes, and that led to milk production as well as letting down the milk through the milk ducts in the breast. Okay, two things happen just by the stimulation of the nipple by the baby suckling. For the first thing is milk production will start, it will keep on going. Okay, and the mother's breast will let down the milk through the milk ducts. Okay, so and as soon as the child is sucking on the mother's nipple, what hormonal changes it's bringing in. Okay, so first is the secretion of oxytocin from the posterior pituitary and prolactin from the anterior pituitary. This is your pituitary gland. Okay, it's situated inside the just behind your optic nerve, just behind the eye's optic nerve. You have the pituitary gland in the center of your brain. Okay, somewhere around the brain, but it is just behind your optic nerve. Okay, that is the situation of the pituitary gland. Okay, it has two parts, anterior part and posterior part. Anterior part means the front part of the pituitary gland. Posterior part is the behind part of the pituitary gland. Okay, so the anterior pituitary gland, the front part, that will secrete prolactin. Prolactin, that is a hormone. Posterior pituitary gland will secrete oxytocin. Okay, prolactin leads to milk production. So continuing the breastfeeding, when the mother keeps on continuing the breastfeeding, okay, her breast will produce more and more milk. Okay, milk production will keep on going as long as the mother continues to breastfeed the child. This is the reason why, because when the child is sucking on the mother's nipple, it leads to the production of prolactin that leads to milk production. Okay, and then the posterior pituitary gland at the same time will secrete oxytocin. Okay, and oxytocin, because of the secretion of oxytocin, the milk is let down from the mammary gland. Okay, otherwise also, even when the child is not sucking on the mother's nipple, but even if the mother hears the child crying, okay, that also uh, initiates similar kind of a response in which the mother's pituitary gland will secrete oxytocin. Okay, any stimuli that leads to the secretion of oxytocin will lead to letting down the milk. So okay, so this is how the milk production is stimulated and the milk letting down is also stimulated. Is it clear to all? Now, hormonal control of lactation, apart from prolactin and oxytocin, estrogen and progesterone also play an important role during pregnancy and during lactation. Okay. So estrogen, it is secreted by the ovary. It stimulates the best breast development. During pregnancy, the mother's breast will develop more fat deposits. Fat deposit will take place around the breast. So breast gets bigger and heavier in size. Okay, it's because of the estrogen product produced by the ovary during pregnancy. Okay, along with that, during pregnancy, placenta also produces progesterone. Okay, progesterone usually is produced by ovary, but during pregnancy, there is no menstrual cycle. So ovaries cannot produce progesterone any longer. Okay, so placenta will produce progesterone. And when the placenta produces progesterone, it is specifically to change the cells of your breast. Okay, it changes the cellular structure of the breast. Okay, it will change the normal cells of the breast into glandular cells. Glandular cells means secreting cells. And what does these cells have to secrete? It has to produce milk and it has to secrete milk. Okay, that is the main purpose. So the placenta during pregnancy secretes progesterone, and this progesterone will change the cellular structure of the mother's breast. Okay, normal epithelial cells will be converted into glandular cells that can secrete milk after pregnancy. Okay. Prolactin and oxytocin, we have seen. Prolactin from the anterior pituitary will stimulate the milk production. Oxytocin, posterior pituitary, will facilitate the release of milk from the milk ducts or alveolus. That is, milk ducts is inside, alveolus it's more of the external structure of the breast. Okay. Is it clear to all? So before going to the nutritional requirements, we'll just go through the factors that affect volume and composition of breast milk. Okay. What can enhance the quality of breast milk? Or what are the things that do not have any effect on breast milk? Okay. So fat and energy means fat in the breast milk and lactose, number of lactose present in the amount of lactose present in the breast milk is completely dependent on how many fat stores the mother has. Okay. The more fat deposit the mother has on her body, more fatty, rich, creamy, and it will be more lactose based would be the breast milk of the mother. Okay. Milk of a primipare has a higher fat concentration than that of a multipare, which means first-time mothers, pregnant women who have become mothers for the first time. This is her first pregnancy. Okay. So during first pregnancy, the milk that you produce that has higher fat concentration as compared to subsequent pregnancies. In the second pregnancy, third pregnancy, okay, you will produce less amount of milk production will be there, but the fat concentration in the milk will be reduced. There is no significant effect of supplementary feeding on production of milk. Okay, the supplementation that you get from Anganwadis and all during lactation, that does not affect the production of milk. That is only for the nutrition of the mother. So mother should not lose her own body nutrients for the sake of producing milk. Okay, to create that balance, supplementary feeding is given. It is not to produce more milk. The frequency of milk removal is important determinant of the volume of the milk secreted, because whatever sucking reflex the child is having, that stimulates the milk production. Okay, so usually if you frequently feed the child, keep feeding the child in very short times, okay, it will inhibit any, it will remove any inhibitor of breastfeeding. Okay, so as much as possible, frequent small meals, frequent small breastfeeding should be initiated by the mothers. Okay. So it will keep, so the breast will keep on producing more breast milk. Don't keep huge time gaps between two feeds. Undernourished mother produces less quantity, but the quality of the milk is same. Okay. Malnourished mothers will also produce milk. The quantity will be less. Okay. ML wise, the volume of the milk will be less, but the quality is more or less same. Lactose, protein, calcium, iron, copper, fluorine, these content are independent of the mother's diet. Okay, how much of a protein the mother is having, how much calcium the mother is having, iron, copper, Okay, whatever she is having, she can't say that I will have more calcium, I will have more protein, so that my breast milk should be rich in calcium and protein. It doesn't work like that. Okay, mother's diet on these microminerals and macrominerals is completely independent of the breast milk. But vitamin B, iodine, selenium, okay, that is dependent on mother's diet. The more vitamin B the mother will have, the more vitamin B will be there in the mother's milk. Iodine as well. Okay, so if the mother's diet has too much of iodine, that could also cause iodine toxicity in the child who is being breastfed. Lactational capacity is genetic. Okay, if your grandmothers and mothers had enough amount of quantity and quality of breast milk, you will also have the same. Okay, it is genetic. And if you are not having adequate fluid intake, the quantity will be less. If the mother is consuming any strong flavored foods like garlic, raw onion, too much of seasoned spicy food that has strong flavors. Okay, so the breast milk will also have some strong flavors out of it. Now coming to the nutritional requirements, energy. So additional energy required for lactation is already present in the mother's body. Okay, the weight gain she had during pregnancy, the more adipose tissue stores she had gained during pregnancy, okay, that will give the additional energy required for lactation. Adult woman, whatever diet she is having, okay, she has to add 600 kilocalories more in her diet during the first 6 months of lactation. After the child has um, turned 6 months of age, weaning diet has started for the child. Okay, she can have 520 kilocalories more up till the first year of the child. Okay, so energy requirement can be divided into these two categories. The first 6 months of lactation, soon after pregnancy, the first 6 months of exclusive breastfeeding, mother should have 600 kilocalories more in her diet. Okay. And after the first 6 months of exclusive breastfeeding, once it gets over, 500 or 520 kilocalories till the next birthday of the child, first birthday of the child is enough. Proteins around 70 gram. Okay, approximately 70 gram should be there. 55 gram of protein is the average requirement for all adult women, with plus 19 gram additional protein just for maintaining the lactation. Additional 19 gram on top of the regular protein intake. Fat, minimum 20% of the energy should come from fat. Okay, 20 gram plus 30 gram, you can add more 30 gram in your diet, so that 500 kilocalories, at least a target of 500 kilocalories can be met. Daily intake of at least 30 gram of visible fat, that would also be more than enough. Okay, at least 30 to 35 gram of visible fat if the mother is taking, that is also more than enough. Calcium, during breastfeeding, only during lactation, 1200 mg of calcium is required for the mothers. Otherwise, calcium from the bone will be taken up to produce breast milk, and that could lead to early osteoporosis in women as well. Iron, 29 gram of 29 mg of iron is what normal adult requires. But during lactation, you can just take 23 mg. You can reduce the quantity of iron taken during lactation because you're not having your periods. Woman during the first 6 months of lactation or during exclusive breastfeeding, she does not have her periods. Okay, and even during pregnancy, the mother is not having her periods. So the loss of blood through periods is null. Okay, the loss of iron through because of menstruation is zero. Okay, so 26 or 23 mg of iron on a daily basis is more than enough. Vitamin A, whatever is the normal requirement, on top of that, an additional allowance of 90 microgram, or in the previous textbook it was 350. Okay, but now it is just 90, additional allowance of 90 microgram, because pregnant women usually go for the vitamin A injections or syrup. Okay, vitamin A syrup will be given to pregnant women, so that is more than enough to maintain the pregnancy. But during lactation, just add more 90 microgram of vitamin A, that is enough. And this can be achieved by adding more liver in your diet. If you are non-vegetarian, add more liver-based diet. Okay, add more fish liver oils, egg, egg yolks, milk, green leafy vegetables in your diet. You can maintain, you can reach this new demand as well. B vitamins, page 173 onwards. This page number is the old page number, not 177. It's page number 173 onwards. Thiamine, riboflavin, niacin, just given. You can read that later. But vitamin B, the bottom line is, should not be deficient, because vitamin B, if something, if the vitamin B is too less or too much, that will be reflecting in the breast milk. The mother's breast milk is completely dependent on vitamin B. Okay, if the mother has less vitamin B in her diet, her breast milk will also be deficient in vitamin B. Vitamin C, add two more fruits, at least two more fruits on top of the regular fruit consumption. Around 65 mg is the RDA of vitamin C for a normal woman. In old ICMR data, it was just 40 mg, but now it is 60 mg. And according to the recent study, 2020, since 2020 onwards, it is recommended that additional 50 gram of vitamin C should be taken. So 65 plus additional 50 gram, that means you will require 1015 mg of vitamin C per day. Earlier, in the previous ICMR data, you mix up all this, you will only get 80 grams, 80 microgram of the vitamin C per day. But now the vitamin C level has been increased. A lactating woman should have at least 1015 mg of vitamin C per day. Fluid, at least 2 to 3 liters of fluid. And this includes your tea, coffee, milk, okay? Juices, soup, buttermilk, milk, all this is including all this, at least 2 to 3 liters of water per day is required. Is it clear regarding the regarding the nutritional requirements? So during lactation, during a woman's entire lifespan, okay, from her birth till her senior age, it is during lactation that a woman will have maximum requirement of nutrition in her life. Not during pregnancy, not during her adolescence, not during her childhood. Every woman, okay, if she is planning to have a child, if she is planning to breastfeed the child, It is during her breastfeeding times. Okay? It could be 1 year, 2 year, 2.5 years, whatever she decides. These few years of her life when she's lactating, this is the time when she will require maximum nutrition through food. Okay. Because if you remember, does anyone remember what was the maximum calories you have to add when you were pregnant during the third trimester? Does anyone remember? The maximum calories you are supposed to add during pregnancy, especially during the last trimester. It's almost around 350 kilocalories or 320 kilocalories, something like that. Okay. It was not more than 500. Even during pregnancy, somewhere between 300 to 400 was the maximum kilocalories that the pregnant woman should have, especially during her final trimester. Okay. But during lactation, it is double. What additional kilocalories you have during the final trimester of your pregnancy, during lactation, you have to have double of that. Okay. So the nutritional requirements are maximum during lactation. So if you compromise this, you will compromise the child's health, the infant's health, as well as the mother's health as well. Then balanced diet is essential. It should have whole grains, complex carbohydrates, good fats, protein, lots of green vegetables, colorful vegetables, fruits, 2 to 3 servings of fruits. And you should have different beverages to meet your milk fluid requirement. Like if you tell a lactating mother, you should have at least 2.5 liters of water. Okay, it will be a task for her. She will find it as a task. Okay, but you tell her at least drink 2 liters of water. Okay, or 1.5 liters of water, that is also fine. But drink a full glass of buttermilk. Drink a full glass of milk. Okay, drink a full glass of plant milk or a juice or have smoothie. Okay, have at least 2 bowls of soup in the afternoon, and in the dinner time have at least one bowls of soup. Okay, you tell that, she will be more enthusiastic about it. Okay, she will think I just have to finish 1.5 liter of water bottle, one liter bottle, I will finish it. So and other 500 ml also I can finish it, 2 glasses I can have, and the water requirement is done. Then I can have more juices, through buttermilk, smoothie, soup, tea, coffee, whatever I'm having. She will think like that. Okay, so but what's happening is her fluid requirement is getting met. Okay, so encourage her to take different beverages so that that 2.5 to 3 liters of fluid requirement is met. Okay, and at least 1 liter of milk every day she has to have. 1 liter of milk or milk substitute, 1 liter. So if the upper limit is 3 liters of fluid, if she has to have, 1 liter is coming from milk itself. 1 liter of water is coming from the fluid requirement is coming from milk itself. Okay, other 500 ml, 500 ml can come from fruit juices, buttermilk, or soup that she is having. Okay, increase the quantity of food to meet the additional nutrition requirements. Quantity of the food has to be increased. Add a spoon of ghee and all at the during serving food to the mother. Add more variety. Supplements can be taken if you are not able to keep up with such huge nutritional requirements. Vitamin and mineral supplements, particularly when it comes to vitamin C. Okay, 115 mg. 115 mg is the vitamin C requirement per day. Okay, so if a person is someone who does not like to have citrus fruits much, okay, she can go for vitamin C supplement. Folic acid supplement, B12 supplement, calcium and iron supplements can also be taken. And if the mother is underage, teenage mothers, and if she's having a multiple pregnancy, like she's carrying twins, triplets, quadruplets, okay, in such cases, she has to take additional care in meeting the required nutrition. Should not be compromised of nutrition. Teenage mothers and multi-para women, multiple pregnancy women. Galactogogue or lactogogues can be taken. What is lactogogue? Okay, these are food that can increase milk production. Okay, that can increase prolactin secretion in the body. Certain examples are like garlic, garden cress seeds, fennel seeds. Okay, these foods, some sont laddu, methi laddu. Okay, fenugreek seeds, fenugreek leaves. Okay, these are lactogogues. They can enhance. These are the food that are supposed to enhance your milk production. Okay, and you can almonds, badam, goat milk, fish, mutton. Okay, so these all are some examples of lactogogues which can enhance your milk production. Some of the lactogogues are mentioned here: garlic, almonds, methi seeds, methi ke laddu or methi leaves as well, coconut, poppy seeds, kaskas. Okay, leafy vegetables, gond. This is the gond. Gond and methi laddus are made for lactating mothers. Dill seeds or fennel seeds are also good. Sago, oats. Weight management during the first 6 months, lower body fat can be lost during just by breastfeeding. Low calorie diet is not at all recommended if the mother is having some weight loss issues. Only after completing her breastfeeding schedule, at least after 6 months of closing breastfeeding, exclusive breastfeeding, or 1 year of breastfeeding, only then uh, she can decide to reduce the breastfeeding frequency and she can focus on weight reduction. But lower body fat is usually used up for milk production, and because of that, weight loss is definitely achieved during the first 6 months after pregnancy. Caffeine, 2 cups on a daily basis, that's fine. That is the upper limit, not more than that. And that too, don't encourage the mothers to have strong coffee or strong tea. Okay. Medium strength tea and coffee can be given to mothers. It's completely fine. Allergenic foods. Sometimes if the mother consumes cow milk products, fish, eggs, peanut, wheat, okay, it could cause some allergy in the mother as well. And this allergy can be transferred to the children also, because the histamines produced can travel through. Sometimes it can travel through, not always. Then any contaminants, spices or strong flavored foods like garlic, onion, cumin, okay, they can change the flavor of your breast milk. I have mentioned that earlier. And also some types of drugs, pesticides and herbicides used in fruits and vegetable farming, yes, sometimes they can also be transferred from mother's milk. DDT as well. Almost all the drugs taken by the mother, in some or the other extent, it is seen in the breast milk. Hence, as much as possible, drugs and medications should be avoided. Expressed milk expression is when the mother is producing breast milk, but the infant is not around to feed on it. Okay, so milk can be expressed and it can be stored. Okay, milk pump, breast pump can be used. So before expressing the milk, always make sure the mother, she has to wash her hands properly. Okay, and there is a technique in which the mother, even without breast pump, during doing circular massages to the breast, milk can be expressed. Okay, in pediatric nutrition classes, we have taught this. But using breast pump is very convenient these days. And you can store the breast milk as well. Okay, you can refrigerate it, freeze it. Then human milk bank. Some mothers may suffer from lactation failure, which is psychological as well to an extent. We'll discuss that. A milk bank. The awareness and benefits of milk bank in the last few years have increased. Okay, and it is used. It has been established in many Indian hospitals. Usually, milk bank is used for preterm babies, premature babies who are not able to suck on the mother's breast because their reflexes have not been developed. Okay. So preterm babies, premature babies will not have certain reflexes that usually a newborn baby has. Okay. So until and unless the child's reflex doesn't develop, the child will be fed on through pallida feeding. The child will be fed. The mothers can also donate the milk. Those mothers who have a stillborn or whose child has passed away during labor or during pregnancy. Okay, these mothers can still produce milk. Okay, they can also donate their milk to milk bank. Then exercise, mild exercises like brisk walking. Okay, these are encouraged, but not heavy lifting or heavy exercises or too much of active exercises is not encouraged. Okay, especially few weeks after her pregnancy, especially after 42 weeks, 42 days after pregnancy, mother can slowly start exercising. When the lactation is well established, there is continuous production of breast milk. The child is also latching on the breast properly. Okay, a good lactation behavior is established between the mother and the child. After that, exercises can be done. Okay, aerobic exercises, especially, but not the one that are cardio in nature. That should not include too much of cardio. Stair climbing, walking, treadmill walking, cycling, swimming. These are the few exercises that that lactating mothers can do. Lactation failure. In some women, okay, they are not able to produce enough milk and they are not able to sustain the growth of normal newborn baby as well. Okay, for the first few months. So in such cases, it is very, very rare. Okay, lactation failure is usually very rare. Either it could be some physical or anatomical structural deformity in the breast, in the milk duct, at the cellular level of the mothers. Okay, that could lead to lactation failure as well. There are few factors associated with lactation failure, like maternal malnutrition. If the mother is malnourished, she will not be lactating properly. If she is suffering from any acute illness like dehydration, not having enough fluids in her body, okay, having a fever because of certain infection. Breast engorgement can also lead to lactation failure. What happens in breast engorgement? That is very common during pregnancy. Okay, the veins and the blood supply in the breast. Okay, the veins, they become engorged, swollen, painful. Okay, you can visibly see the veins and the blood supply of the breast. Okay, it is completely swollen up. Okay, the breast become very tender and very painful. You have to put some mild hot application for pain reliever for the mothers. Okay, so this breast engorgement could also lead to lactation failure. Sore nipples. Okay, if the child is not sucking properly, if the child is not latching properly onto the nipples, that could also lead to sore nipples. And in some cases, mothers have inverted nipples. Okay, in nipple, usually it should protrude outside. Okay, even with a slight stimulus, a mother's nipple should protrude outside. In some mothers, in some women, they have inverted nipple. Okay, the protrusion is inside. It is inverted in. So in such cases, lactation failure can happen. Lack of confidence, any occupation or socioeconomic condition in which the mother and the child is not able to spend quality time with each other. Okay, that could also lead to lactation failure because the presence of the child around, the child crying, okay, child's smell, holding the child to close to heart, giving kangaroo mother care to the child. Uh, these are the activities between the mother and the child that enhances breast milk production. Okay, but if because of her socioeconomic condition, the mother is not able to spend time with the child, soon after her labor, she have to go to work, or she is a she's in labor work, or she's coming from a below poverty line family. Okay, she has to give her hands in her family income as well. So she will be separated from the newborn baby. Okay. More the separation is, more will be the lactation. Is my screen visible? Am I audible? Okay. So lactation failure, when the mother and the child is separated for too long, or the mother is not able to see the child on a daily basis, that could also lead to lactation failure. Incomplete emptying, that is when the breast milk production has begun, the breast is full of milk, but the sucking by the baby is very weak. The child is low birth weight, premature baby, okay, or may the child sucking reflex is not developed properly. Okay, in that case, the child will not be able to suck and empty the breast properly. Emptying is important. Whatever breast milk production is happening, okay, the child should be able to suck it out and empty the breast. So the mother will feel relieved. Okay, when there is incomplete emptying, okay, during the breastfeeding, that could lead to lactation failure. Infrequent feeding, unscheduled feeding. Okay, should try to develop and maintain a schedule of feeding. Okay, morning at 5 o'clock, or whenever the child wakes up, the child will also have a sleep wake pattern. Okay, based on the child's sleep wake pattern, try to put the child, accommodate the child into a scheduled feeding process. Okay, then pre-lacteal food feeds like formula feeds. If you're giving for any formula feeds to the child will be no longer hungry. The child will not want mother's breast milk. Okay, separating the mother and the baby. Maybe because of some complications in pregnancy, the child is admitted in an ICU. Mother is admitted in ICU because of some severe complication during labor. Okay, after a week or so, the mother and child unites. So medical separation of the child has took place, of the child and mother has took place. That could also lead to lactation failure. Okay, so these are the reasons, different reasons of lactation failure. Is it clear to all? Then medications. Anti-cancer drugs, if the mother is on any chemotherapy drugs, okay, mother has some cancer or she's in any chemotherapy drugs, that could lead to immunosuppression in infants. Okay, that could suppress the immunity in the infants. If the mother is breastfeeding as well, when she's on chemotherapy drugs, it will lead to immunosuppression. It will suppress the immunity of the child. Anti-thyroid or iodine medication. Okay, if the mother is taking any, the mother is suffering from hyperthyroidism, okay, and she is taking anti-thyroid drugs, or she is taking iodine supplements because of hypothyroidism. Yeah, if any thyroid medications if the mother is taking, that could cause damage to the thyroid tissue of the child as well, because iodine can travel through breast milk. The iodine content in the mother's body, if it increases, it will increase in breast milk as well, and the child will also have high iodine. Then ergotherapy, it is used in migraines. Okay, ergotherapy, that is medications taken during migraines. If the mother is suffering from migraines and she takes ergotherapy, this could lead vomiting and diarrhea in the child. A lactating mother taking ergotherapy, ergo medications can also travel through breast milk and cause vomiting and diarrhea in the child. Oral pill thiazides, pyridoxine, nicotine, okay? These different kind of thiazides, any form of thiazides, that could also lead to suppression in lactation. Laxatives, too much of laxatives, if the mother is taking, if the mother is suffering from constipation and she is on laxatives, it can give diarrhea to the child. Okay, laxative will increase the intestinal motility. Laxatives can also travel through breast milk, reach the child. It will increase the child's intestinal motility and it will lead to diarrhea. Antibiotics could lead to stomach issues in the child. The child may suffer from gas or enteritis, gastroenteritis, stomach cramps. So Indian nursing mothers, if this applies to all the poor communities in India, okay, mothers who come under the BPL category, below poverty line category. So in all the poor communities in India, all mothers, lactating mothers, expectant mothers, they usually take rice or wheat and very with little pulse and vegetables. They're not having enough protein or enough fiber in their diet. And uh, even if milk is used in tea or coffee, that is the only milk that they can afford. Okay, Indian nursing mothers who are from poor community, they cannot afford 1 liter of milk to themselves. Okay, so in such cases, mothers have prolonged malnutrition. Okay, they will be like, it is a custom in India that you have to feed your infant for prolonged periods ranging from 6 months to up till 3 years. Okay, at least till 3 years you should be breastfeeding. Some Indian communities, they still follow that, but they will not give good food or nutrition to the mother, and they will not give nutritious weaning diet to the infant. Both are deprived, both will be malnourished. Okay, because of such practices. Especially women who are in the low income group, they do not have adequate weight gain also in pregnancy. And if adequate weight gain is not there, they will not have enough fat in their body to produce milk later on. So it gives us this vicious cycle. If you see from here, if a woman who is malnourished or she has low pregnancy weight gain, okay, a malnourished woman will give birth to a malnourished baby, a low birth weight baby or malnourished baby. They are still in that poverty cycle. They're still in the poverty line. Low birth weight baby will grow into a stunted child who has not achieved enough height. Okay, stunted child. A stunted child will lead to a teenager who is also stunted. Okay, who does not have enough growth and development. And in majority of the poor Indian communities, women are married very young. even as young teenagers, they are married off. So this young adolescent who is stunted, who does not have. Am I audible? Is my screen visible? So this adolescent who is stunted, who is malnourished, stunted, if this girl becomes pregnant, she's again a woman who is malnourished and she's malnourished pregnant woman. And this cycle, she will also give birth to a low birth weight baby. So generation after generation, this cycle keeps on going. Okay. So this is the Indian nursing mothers, the issues that Indian mothers who are nursing, who are lactating, face, especially if they are from a poor community. So according to ICDS, to combat this issue, Integrated Child Development Scheme, they have a program for lactating mothers as well, where 160 gram of sattumavu is given. Okay. This is sattumavu. Lactating mothers are given 160 gram of sattumavu for 15 days. It's a health mix. For 15 days, they have 15 packets. That is the quota. Okay, 15 days quota, 15 packets. Each packet they have to finish within 1 day. And this sattumavu, it will give mothers 600 kilocalories just by mixing this up in water or milk, and having it will give the mothers 600 kilocalories. And this has 18 to 20 gram of protein. Sattumavu, the sattumavu has 18 to 20 gram of protein. Okay, what is sattumavu? It's a mix of all these pulses, legumes, and some spices like cardamom, nuts, seeds, and nuts. Okay, all these are roasted, equal quantities. Majority of them, equal quantities of them are taken. Okay, it is little bit roasted into an aromatic roast, and then it is ground well, separately mixed, and it is given. Okay, 160 gram per day is taken. Apart from that, what other recipes lactating mothers can have so that this calorie and nutrition requirements can be maintained? Okay, having some badam kheer, groundnut kheer, carrot halwa, caramel custard. Okay, that can give you a good fat requirement, energy requirement. Garlic and onion chutney, if you have it with dosas, idli, or even with chapatis, if you have garlic onion chutney, that's a lactogogue. It can enhance your milk production. Soups and rasam, having a lot of rasam and soup in your diet will take care of your fluid requirement. Snacks like vada, bhaji, parathas, paneer, okay, they are high in calorie, so calorie requirement will be met. Protein requirement will be met. Making paneer parathas, okay, sattu paratha, sattu ka paratha, whatever is there, okay, you can have that to maintain your protein requirement also. Goond laddu or methi goond ke laddu, okay, that is lactogogue, and also it's a nutrition dense and energy dense food. Garden plus seeds laddu, okay, these things you can have. These things can be made for the lactating mothers. So that's all for today's session. If you have any queries, you can mention in the chat box.